I don't feel like it's my job to make anyone do anything. My mentor told me, Rick, sometimes just a single extraction is a full treatment plan for that person. You really helped them. That's what they needed. That really helped them. And I don't try to talk everybody into a big elaborate treatment plan. The best example of this is probably my dad. So nobody in my family was a dentist, so I went to dental school, and I grind my teeth. So as I'm learning about it, I'm like, oh my gosh, I do that. So I went to the lab that afternoon and made a night guard for myself, and I've worn one faithfully since I was 22, so I don't have a lot of wear in my teeth. But once I learned about that, I called up my dad. I said, Dad, listen, you grind in spades. I need to make you a night guard. And my dad's pretty old school. He's like, retainer? Why do I want to wear a retainer? I'm not wearing a retainer. So my dad doesn't have a night guard. So, but that's his choice. And I don't try to tell people what's best for them. I try to tell them, hey, these are the possibilities. What do you think? What do you want? What would you have us do?